What breathing techniques manage cystic fibrosis exacerbations? Imagine breathing easier during a tough time with cystic fibrosis. When lung symptoms worsen, managing mucus buildup becomes crucial. Breathing techniques are a key part of this process. They focus on clearing thick mucus from the lungs to improve airflow and reduce infection risk. The most well-studied method is the active cycle of breathing technique, which combines gentle breathing, deep lung expansion, and controlled coughing. First, breathing control involves slow, relaxed breaths using the lower chest. This helps relax the airways and reduces resistance. Breathing is usually done through the nose, with the lips pursed to create back pressure that keeps the airways open longer. This phase acts as a resting period between more active clearing exercises. Next are thoracic expansion exercises, where you take deep breaths to fully inflate the lungs. Sometimes you hold these breaths briefly to allow air to reach behind mucus obstructions. This helps loosen secretions and improves lung ventilation. These deep breaths can be combined with chest physiotherapy techniques like clapping or vibration to help move mucus toward the larger airways. The third component is the forced expiration technique, often called huffing. This involves controlled, forceful exhalations without a full cough. Huffing helps move mucus from the smaller, peripheral airways toward the larger central airways, where it can be coughed out more easily. Repeating huffing cycles along with breathing control optimizes mucus clearance. These techniques can be done independently and are often preferred because they empower individuals to manage their airway clearance during exacerbations and daily routines. Research shows that the active cycle of breathing technique is just as effective as other methods like positive expiratory pressure devices, autogenic drainage, oscillatory PEP devices, and high-frequency chest compression. No single technique has been proven superior, so the choice depends on what works best for each person based on their preferences and response. During a cystic fibrosis exacerbation, airway clearance efforts like these are usually increased to handle the extra mucus and inflammation. Aerobic exercise can also support airway clearance and overall lung health during these times. In summary, managing cystic fibrosis flare-ups with breathing techniques mainly involves the active cycle of breathing technique. It combines gentle breathing, deep lung inflation, and controlled huff coughing to loosen and clear mucus. These methods help maintain lung function and improve quality of life. They are part of a broader airway clearance plan tailored to each individual and should always be used alongside medical treatments prescribed by healthcare professionals. Always consult your healthcare team for personalized advice and guidance.